We are live now, doctor.
So, good evening, everyone. On behalf of the Maharashtra Ophthalmic Society and YOSI, the Young Ophthalmological Society of India, today I warmly welcome you all to today's webinar, which is a MOS YOSI collaboration webinar. And today's topic is very interesting. It's use of AI in the ophthalmology workflows. It's extremely relevant in today's world. And since the world is rapidly transforming in the way we diagnose, in the way we analyze, and the way we manage our patients. So we're very much delighted to see such an enthusiastic participation, and I hope this webinar will be useful to all who are spending their precious evening with us. So without much ado, I am just going to start this webinar, and now I would like to invite my co-moderator, Dr. Preeti Kamdar ma'am. She is going to introduce our esteemed faculties for today. Over to you, ma'am.
Thank you, Rakhi. It's a pleasure to be here in the MOS YOSI collaborated webinar, and good evening to everybody. So let me begin by first introducing our chairpersons. Our first chairperson is Dr. Anaga Herur, who is the president of Maharashtra Ophthalmic Society, and Dr. Devakant Misra, who's the president of the Youth Ophthalmologist Society of India. Both of them are very dynamic people, and they have made this collaboration a very lively one. So over to you, Dr. Anaga Herur, for your address.
Yeah. Thank you so much, Dr. Preeti, and very warm welcome to all our esteemed panelists, the speakers, moderators, and to all our viewers. In fact, AI is something which very soon all of us are going to require a lot. Already, we are seeing how we are using it, but to guide us as to what exactly and how exactly to use it to our benefit, we are going to have a good presentations today, and we have basically focused on how to use it for our presentations, which all of us are doing, the scientific presentations as well as for the statistical analysis. And for that, we have great panelists, respected Dr. B.K. Nayak sir, Dr. Rajesh Joshi, and Dr. Santosh Onawar sir with us. And we are really looking forward to this webinar today. So over to you back again.
So, thank you, ma'am, for those inspiring words. So now it's my honor to introduce to you national faculty for today is none other than the Dr. Santosh Onawar sir. He is a man who needs no introduction. He's a true stalwart in Indian ophthalmology. Specialty is ophthalmic plastic surgery and ocular oncology. He was trained in ocular oncology from Jerry Shields and Professor Carol Shields in Wills Eye Hospital, USA. And he established the ocular oncology services and LVPI. Currently, he's heading the Department of Ocular Oncology at Center for Sight, Hyderabad. And currently is the Honorary General Secretary of AOS. He has multiple awards, national, international, numerous publications. So we are very happy and delighted to have you here, sir. Welcome to the webinar. So next, I think sir has joined late. So next, I would like to ask Dr. Preeti ma'am to introduce the panelists for today.
So we have four, the panelists are all, it's a star-studded galaxy, and we have four panelists. The one is Dr. B.K. Nayak, who needs no introduction. He has donned, all of them have donned multiple hats. And one little known thing about Dr. Nayak is that he was trained to be a retinal surgeon, but we all know him as a very eminent glaucoma specialist. He's the past president of AIOS and one of the and the past president of GSI and one of the senior most glaucoma surgeons of Mumbai, and one of the people whom I call my mentor. Okay, so this and the second, so welcome sir to this webinar, sir. And he's a person who really doesn't participate too much in webinars, but he's here for us, and that's really a catch.
Yeah, that was a special invitation from me, sir. Thank you so much for accepting it.
Yeah, because when Naga invited or Preeti invite, then I can't refuse.
How sweet, sir.
Thank you.
Thank you so much, sir. The second is Dr. Rajesh Joshi. Again, he is one of the prominent personalities of Maharashtra. He's the chief editor of our Maharashtra, of the journal JCAOR, and he has taken that journal to another level, and he's a thorough researcher. And if you speak to him, he's one of the soft-spoken and kindest gentlemen I have ever met. So welcome, Dr. Rajesh Joshi. It's a pleasure to have you here. The next is Dr. John Akara. Again, he says he's a glaucoma specialist, he's a refractive and cornea specialist. But if I had to describe him in one word, he's an innovator. So every time he presents at different conferences, there are different innovations. So welcome, Dr. John. And the last, just a minute, okay. Yeah. And the last but not the least is Dr. Gunjan. Dr. Gunjan is a cornea and anterior segment specialist, and she practices in Delhi, and she's a very dynamic and very active member of YOSI, the Youth Ophthalmic Society of India. Welcome, Dr. Gunjan. And with this introduction, let's go over to I give it over to you, Dr. Rakhi, for further introductions.
So let's now move on to our first talk of the day. Everybody will be eagerly waiting for the first talk, and it's my pleasure to introduce my dear friend and our first speaker, Dr. Pranesh Ravi, who will be talking on Smarter Presentations Made Easy. Dr. Pranesh is a cornea and phaco-refractive consultant, and he is a team leader of YOSI Bytes, editor of Snippets podcast, and academic contributor with over 5 book chapters and 15 index publication. He is serving multiple editorial roles and a tech-savvy ophthalmologist and a member of TNOA, your task force and group. So over to you, Dr. Pranesh. Let's hear from you.
Thank you very much, Dr. Raki, for the introduction. In the outset, I'd like to thank Anaga ma'am for the invite, the chairpersons, Diva sir, the moderators, and Santosh sir for being here, and to the respected panelists and my friends. So I'll start sharing my presentation. Is it visible?
Not
It's
yet.
starting, not yet. Yeah, now,
Yeah.
yes.
Okay. Yes. Is it visible, ma'am? Is my voice audible?
Yes, it is.
Yeah, perfect. So the presentation for today, my topic is let AI do the talking, smarter presentations made easy. So I'll be talking about ways to go about how to make smarter PowerPoint presentations and how to do it in the most effective way. To start with, like manually presenting has doing the groundwork and all has stopped now because we have artificial intelligence which can speed it up like 50 times faster, make it 10 times better as far as design is concerned, and you get 15%, 500% of ROI as far as presentation is concerned. So we'll talk about different facets of doing much more better presentations with AI, and then we'll go about it one by one. So before using these AI tools, it is very important that you know that you should not completely depend on it. Your literary knowledge should be very good before using this because only then you can pick out the caveats in these presentations. And these can make trivial mistakes, and they usually tend to extrapolate text. First, ideology is using notebook LLM. I have a barcode here, which is the prompt which you can use. You basically what you do is you paste a battery of sources in this, and then ask the AI to give a structured outline presentation based upon your tone and depth. And there are now, when I started, there was no slide deck, but now there is a slide deck in Notebook LLM. So basically what this does is this is an AI which searches for sources in the stuff which you had pasted, and it doesn't look for external sources. So basically what happens is you are actually saving or giving less trust to the AI so that it doesn't have to look around the web and search for a lot of references. So what it basically does is it saves your time, improves clarity, and it ensures structure. And if you use your custom prompt based on what your presentation is going to be, you can use my prompt, or this is actually a season prompt. It does really well. So I'll just showing you an iteration of how Notebook LLM works. So this is all the websites and the journals that I've pasted for T-First use to, and you can see a slide deck which is already going around based on the source I've got the slides for the presentation in Word format, but you should be really conscious that you know about this topic, and then post this content. You can easily use it to generate your slides. The problem with slide deck is it is limited to 13 to 15 based upon it, and it can make some text-based mistakes. So you can use the Word format if required. So the problems with these slide decks can be corrected with Canva. You can go over the text and make some corrections in Canva. It requires a Canva Pro, and you need to use the grab tool. You can edit the AI generated text, but the backgrounds and all you can't. You can still grab it, but it will have some issues. So why it matters is because it will cause some inaccuracies in the text, and you can add some human clarity, and it saves time. So I'll show you how it happens in Canva. So for instance, this is a AI generated. This is a slide deck generated by Notebook LM. So you can use the grab text option in Canva. So it will go through the text, and it will kind of highlight all the text in these, and you can select the complete thing in entirety, or you can select whatever you want to change. So I'm just trying to change the title now, but now I'm changing it to mapping the AI presentations. That's it. And now I'm again trying to grab the text once again, and then I'm just changing one facet of the presentation. So this is something which you can do, but mind you, if you do this, the font will change if this application doesn't have the set font. And the second caveat with this is you need to use Canva Pro. You can again edit it in Google Slides, but this is a much better workflow. But the only caveat is you require the Pro version. Second thing is, limitation is the slide deck is 15 slides. If you have to get the output in Word, then it regards to how much ever you can, whatever you prompt, it's going to give. And it also depends on the quality and the depth of the source of the input material, and also the prompt. You need to have Canva Pro, and it is okay for initial structure, but not very good for, it is very beautiful in the outset, but it's not very detailed and in-depth and critical. So if you take all the AI slide tools in comparison, everything has got one best thing if you talk about. So Gemini, you can directly export it into slides if you do it in Canvas, but it will give you a very basic slide. Notebook LLM for research. The slide deck is exceptionally good. The graphics are super amazing, but it has a lot of errors. Gamma is speed, but just like how it is in PPT. Beautiful AI, the design is good, but it is very auto aligned and responsive. Canva, the visuals are great, but this is more user friendly. Tome is for storytelling, and my Copilot is, you can directly use this in your Microsoft the PPT PowerPoint if you have the Copilot subscription. So that is also a caveat in this. So limitations is, I'm talking about Gemini is formatting. Notebook LLM is, you cannot, if you have a very image-based slide which is generated, you cannot change much. So Gamma has repetitive designs, beautiful layout. It is very, you cannot change a lot. And Canva, you need a lot of manual refinement. And Copilot is, the licensing is the issue. So now coming to other methods, these are my favorite methods. I use it quite frequently. So what I do is, you have two facets where you can do, one thing is called as VBA automation, another thing is called words to slide. I'll just jot it down, make it very simple so you can understand. So VBA automation is, so we have the visual editor in PowerPoint. So what happens is, you have to get the output in VBA code, which AI can generate, and just copy paste it, and then you can click it run. I'll just show you how this workflow works. So this is a presentation on collagen cross-linking, which I'm asking in VBA code. But mind you, when you're generating it in code, so all these consume tokens. So usually it will try to truncate the text, but if you can generate every slick slide, you'll get a detailed slide. I'm trying to get a proper, like say 5 to 10 slide, but this is how it will come. But the advantage of this is, you need not do much of mental math, and you need not work out too much on the slides. It just gives you the whole complete thing, and then you go to the Visual Basic applications in PowerPoint, which is there in the developer option. You click on Visual Basic, and then you just open a module, and then you paste this in entirety, and then I'm sorry, just one second. Yeah. Then after that, what you do is you just click on run here. So once you run it, that's it. The slide is created. And you can see the slide is completely created. And then you can go to design and then choose your desired design. And you can that's it, you'll call it a day. But one more thing what I want to tell you is, because these code will usually take a bit of tokens, so it's always better that you generate in small chunks, or in VBA code, so you'll get a detailed output. And you can also change the output based upon your prompt, or you can get the whole slides and then you can change it to VBA code, so the slide making will be much more easier. So this is the final output with VBA code. So if for instance, if somebody is finding this to be too difficult or too technical, or if they don't have an older version which doesn't have the a Visual Basic, then you can do what you can do is you can convert Word to slides. Basically, you have to change the indentation of the output that you have, which is AI generated, and then you can kind of convert into Word to slides. So this is how the structure is. I've got a slide structure here. Basically, it is advisable that you don't use this AI structure. You just use it as a skeleton, and then you can work on it so that your making presentations would be faster. So you go. So what happen? What here you can you go to view, and then you go to outline. You click on this outline. So what happens? Then you will get a outline like this. So it is showing 9 levels, and level 1 use one indentation, then you move the subsequent text to level 2. So what you just create an indentation. So the when you then export it to PowerPoint, it will understand that that you are kind of causing indentations, and it will arrange the stuff in the slides accordingly. I'm just showing you an example, working on say the first 10 slides where I'm marking. You can do this marking by pressing Control and selecting all this. And then you make it level 2. So the indentation has been created. You can close the outline view, and you can save this Word document, and then you can create a new presentation, and then you can go to insert in table you can go to this one second actually. Sorry. Yeah, you can new slide, you can take slides from outline, and then you can open this Word document. Yeah, that's it. Your slides are done. So then you can change your design and add the thing. I know this is not a complete presentation, but you can still use it as a skeleton and work on it. So thank you. Thank you very much for your patient listening.
So thank you, Pranesh. That was a very great presentation. And I think it is very difficult to comprehend everything in this short time. But I think now people can use this to make slides. But what I didn't understand here is, so you had actually given the total structure, right? And then just given us the prompt to make it into slides, right? So the structure has to be
Yes.
made by the human mind itself. That means ourselves, right? Or the content can also be created by them into slides by AI.
Okay, so basically it depends upon the context which you place. If you ask it a structure, it will create a structure. Or there are two ways of doing it. If you're you can use it as a skeleton, or if you want the slide topics to be on a specific topic, you can give it as a prompt, and it'll give you a proper structure.
Okay.
If you do
So
it if you give the sources and ask it to do it, Notebook LLM can do it. You can do it in entirety for all the slides, or you can work on one slide at a time. That's also possible.
okay. So now I would like to ask the panelist, Dr. Gunjan. So have you tried AI in any of your recent presentations, and which is your favorite among all that has been discussed by Pranesh?
Yeah, actually not tried. Actually, I'm now making all the slides through AI only because that's how, it's getting better and better. So I think to add on to Dr. Pranesh's discussion, very nicely touched upon Notebook. What I try to do is first I try to get the content from ChatGPT also and verify whether, it's written nicely. Then I create a skeleton from there, and then I put a commands on different platforms, and I see which one is creating it better, because it hardly takes 5 minutes to go and see at the platforms which one is creating a better slide. So this one I did for all my AIOS slides this time, and some of them were really nice. I couldn't do it with just one tool. I took it from ChatGPT. I put one in Google Gemini, and then I created a mixture version onto my Microsoft PPT, from where I could use Copilot, and it created a very beautiful version, and I could design it further. So, it's a mixture of the tools that you can take help from. And I think the generation of the content can be nicely done from ChatGPT as well. So that's how I perform that way. It saves a lot of time actually. And sometimes you can put a specific command also if you want to get source from PubMed as well. It ChatGPT deep thinks and also does a good job that way.
Okay. Dr. B.K. Naik, sir. Sir, what is your opinion regarding this new generation of making PPTs with AI?
You see, I'm an old timer and done everything hard way myself. So I am not really very much convinced with the idea. Of course, it's helpful, but not giving everything to it. Because I'll just give you one example. Today I was taking a lecture to my DNB students in my institute, and I just simply asked one definition. What is the definition of perimetry? Immediately, one student went to Google and then started reading. I said, I didn't ask Google to tell me. I'm asking you. You should have read it before and you should have told me on your own. So what I mean to say that these things are basically, I feel, making your brain means less active. And probably it's also, I think, today only I was reading one article where it was written that the creativeness is definitely getting lost in this, because what is your creation? Everything. Chat GPT gave you the content. Then all those, whatever was presented, that give you the content of the, sorry, the format of the slides, presentation. And then you just simply went there and told that. And that also what I want to emphasize, that one part is preparation of the slides and presentation. And second part is how do you present it? Because in this, I have to make one comment. Your voice has to be very loud. Because I attended one this thing session where how to make good presentation. Of course, that time Chat GPT and those things were not there. So in that, one of the point which was mentioned, that suppose you level in the range of your voice 1 to 10, it should be 7 or higher. Otherwise, you will not get, because you want attention of the audience. Then your content, you should be, say, suppose you have got, don't say at the end that, oh, such a limited time, such a vast topic, I couldn't cover everything. It means probably you are a fool. Because you know what is the time. If you are really expert in the subject, then you know in this much time, what are the most important things which I have to convey and which I want to convey and how to convey this. So in that, if you just crowd all the slides and just simply go on running, oh, because of shortage of time, I'm just running through. This is not going to help at all any audience. And these days, because of the social media and because of the online, every time those digital media, within 2 minutes, the audience will be on the WhatsApp or on the something with mobile and chatting or doing something different rather than concentrating on the lecture. And lastly, so probably I don't know whether I am able to convey my feeling properly or not. And I remember, because those only the old timers will remember, Preeti will definitely remember Dr. Ravi Thomas, who is unfortunately no more now. He was a very good speaker. And once I invited him, I said, Ravi, I want to call you for this meeting. He said, how much time are you giving? Not for the talk, for the preparation. Then he told me no, because I said it's only 3 weeks. He said no, for one talk, I want 2 months of preparation. and he used to rehearse that presentation before coming to the main part. So these are the things which is probably your creativity is there, and plus how do you present that? Means anyone can make best of the slides for you, but then if you don't present it properly, it is all gone into the drain. So I don't know. Means but of course it's a very good thing. But one thing I want to warn, that don't depend entirely on these things. Take help, do studies, know the subject, then you can take help that, okay, give me is properly summarized or properly prepared or what are the things, and plus your own intelligence that in given time, given topic, what are the most important, say suppose you can discuss only 10 points or 12 points, then what are the most important 12 points that I must convey and I should be able to convey to the audience, because in 10 minutes, 15 minutes, no one can make Pandit, anyone from the audience. So at least if you generate the interest, you are successful in that, probably you are a very good speaker, your presentation is very good. But anyway, I thank the speaker. And just I had a little query because his name spelling was double S. So is it some numerology because of that? His
Yes. It was my
numerology.
parents' calls
That
that, so I
also
couldn't.
Chat GPT told you to put double S?
No, sir.
Okay,
It
so
was a
sorry about that.
numerology.
Sorry about that. But just I
No, no,
noticed
no,
that.
no, no problem, no
But it
problem,
was
sir.
a good
Perfectly
presentation,
good.
no doubt.
Perfectly good. Thank you very
Oh,
much, sir.
okay.
Thank you, sir. We agree with you, sir. Yeah, we should be using AI, but the content creator should be us. We should still use our ability of the human creativity to make the content, and then we can modify it with AI. Right?
And
So,
one
Dr.
more point
Rajesh,
I just ethical point, because I am really concerned about the ethics part, that whenever you're taking this kind of help, you must acknowledge that I have taken help of this in presentation of this slide or the content. So then at least that means probably audience will rate you higher if you declare that, rather than just simply say that audience will, yes, he was just from somewhere, chat GPT told him this is to talk this way and then he did that. So you must admit and you must acknowledge.
true, sir. So, Dr. Rajesh Joshi, sir. So, what's your take on this? Have you tried AI in your recent
Yeah,
slides,
yeah,
and in what field you think that slides or making using AI is most helpful?
yeah. Very nicely presented, Dr. Ravi. Um, but in fact, I never used AI for my presentation. But maybe combination of whatever you do routinely for the preparation of the topic or for slides in a PowerPoint format, along with help of AI, could be will add to your presentation more rather than just using AI only for presentation. I will try, but I think my old way of preparation of the PowerPoint appears to be good rather than whatever he presented. But maybe I will try. Of course, as Dr. Nayak has said, it lacks human touch. And of course, at the end of the presentation, you should always acknowledge from where you have taken all the content. That is what is my take on Dr. Ravi's presentation. Thank you.
I think, but for
Over to you, Rakhi.
some topics in which we don't have a clear idea of how to go about it, like something which are
Yeah.
non-academic. And I think in that cases, the ChatGPT and Google Gemini, everything helps a lot. I recently had a non-academic presentation and I was unsure how to present and what should be the striking points which I should make. It was for a debate. For that, I think I put some inputs and some ideas, but the way the chat GPT had given me the complete flow of the slides, that was amazing. So I got some clarity on how should I go about it, and from that I started. So I think some topics it is actually very useful, and Google Gemini, Canva, everything is super fast. It makes your work like one presentation which usually takes us to make 1 or 2 days, the same can be done in 1 to 2 hours time.
Right. Absolutely right. But if you try Google Gemini, it will give you entire world's data. Like if you suppose if you want some guidelines from India only, they may not be there. You will have to see, you have to chalk out all the guidelines and then prepare presentation accordingly. Because it will take into account entire world's guidelines. Suppose if you want to have guidelines from India only, it may not give you from India, maybe entire world. So that you need to see while preparing the presentation. That is what it lacks.
Okay. So now to Dr. John. So all these people were making slides with AI. Is there any app that can actually create animations in slides also with AI? Dr. John's
John, yeah, he's
is
frozen actually.
frozen.
Yeah.
So Dr. Pranesh, do you have an answer to this?
Animations are possible, but you can do it. You can change an image to an animation. There are workflows for that. You have Comfy UI, but you need to use API credits. And these applications, Grok or everything can do it. Or you can make a custom animation and you can take a call. If you want to make a prompt, make a custom animation, or you have an image from image to animation, those can be made.
Dr.
Yeah.
John,
So I
any
would
thoughts?
use hello.
Yeah, you're
Yeah. So
back
I
now.
would use Gemini and Nano Banana to make some images, and then I would use video to make an animation from that. So
Which
I
one? Which
would
one?
usually try to incorporate some joke. So Nano Banana. So that is Gemini has Nano Banana for making images, and also the video part from VO. So I would generate an image with Nano Banana, and then I would use VO to make an animation from that, and I would try to incorporate something funny into it. I would try to incorporate some joke into that to make the presentation more lively. So that is what usually I use AI, and of course to get the general gist of how to go about the topic. So once you have that, and once you have some individual images and animations to put here and there, that is probably my style of using AI for presentations.
If you can type these into the chat box, so then it'll remain. We'll be able to give it to others. If you can put it in the chat box, whatever you've been using, whatever
Right.
app you have named, please. Right?
Yeah.
Basically, any if you use Gemini, if you ask it to create an image or create it a video, it will directly use VO and Nano Banana by default. So
Okay.
It is available for everyone, or you have to be a pro user for that, for
free
creating
user, I think
videos.
4
Free use.
and 1 video. I'm not very
Free
sure about
has,
it.
Per
For
day.
pro users,
yeah.
it's unlimited.
Free
Video
also
generation
has
is four per
some
day.
limited time. Yeah.
There is actually a trick. So if you have a Geo SIM, you can get a Gemini Pro account for 1.5 years. So you can just activate that.
Okay.
And
But a
if you
student
want to
will be
share
taking
it, and if you want to share it with others, you can actually add everybody whom you want to share it with, I think up to 6 people, as family members. So
Okay.
everybody who is a family member, so that means friends, anybody can be family member, in your Google group, family group, gets the same privileges. So you can adopt a family.
So make
Yeah.
friends with people who have a Geo
Yeah.
SIM, yeah. You'll be only best
Yeah.
friends.
I have a question, Preeti.
Yes,
Can I
Mhm.
ask? Can I ask?
Yes, ma'am. Yes,
of course, madam. Please.
Suppose I want to make a video of myself, but I want to add certain pictures in that. How do I go about it? Because see, I'm a novice in this, but I want to learn. So, how do I go about it? Anyone can tell me?
Dr. Pranesh, Dr. John, any of you?
So you
If
have
you
to
want, you can,
attach all these source images into the chat. So it is not a single prompt thing. You don't simply ask one single question and it generates thing. You have to give it the source images. So if you have some images which you want to add, you
Yes.
put those images, and then if you want to make a video, ideally you make a starting image. So you say the video starts like this. So even the starting image, I generate it with Nano Banana, and then I edit it till I get the starting image that I want. And if you
Okay.
have an idea of how the image should, how the video should end,
Hmm.
make the ending image also. And then you say, this is how the video starts, this is how the video ends, and this is the entire story of what happens. And it generates by 8 second, 8 second steps. So that is what I have right now. So then you have to say the entire thing. This is a 16:9 ratio video. It is a fun video. The background music is a fun track. Then this is what happens. The person on the left side of the image does this, and then this happens, and it ends with this person, laughing. Then that entire big huge paragraph prompt, along with all the source images, including the starting image, ending image, the person, the image which you want to incorporate, everything has to be attached, and then you prompt it. And then if the prompt has not given you the exact thing that you want, then you refine it further. You say that much is good, but then I want this part of the video to be in a darker tone or something like that. So then you keep editing by giving more bigger, expansive prompts.
It sounds very complicated.
No, madam.
No,
What
ma'am,
It's not.
I'll
usually,
make it, ma'am, you
yeah,
can
Pranesh.
change an image to an animation. That is one thing. That's what Johnson was trying to say. You can fuse two images or you can generate an own image. I think there are websites which generate prompt for videos also. You can even use that. You can start with something small and then go through the prompt, make changes. It's not very complicated. It's very easy.
Okay.
Ma'am, the one which I said, that is if you are very specific in what you want. If
Yeah,
you're just looking for a random idea, you can just say make a video of this and it will
hmm,
make a video of that. But if you want something very specific, then you
yes.
say you make a video of this, but start with this image and end with this image. That's all.
Okay, okay. Got it. Let me try. There's
Yes,
no,
ma'am.
there's no harm in learning at any point of time.
Oh,
Yes, ma'am,
absolutely.
sure.
You will become an
But
expert very soon, ma'am. You will be teaching us.
no, and
Oh,
I'm sure she'll do it. She's one of the most dynamic personalities of Maharashtra Ophthalmic Society. She's the former
wow.
president of MOS. But believe me, she is as young as a 20-year-old. She'll
Oh,
keep us up. Yeah. So thank you, madam, for attending this webinar. Really blessed.
no, no. I wanted to learn. I attended Sabyasachi's lecture on Monday, and I saw this, so I thought, okay, I must attend this.
Great.
Because, uh, there's no age for learning, I think.
True, madam.
At
True.
any age.
True.
So
Why not? Why not now? Thanks.
So,
Thanks a lot.
thank you, ma'am. So now I think we'll move on to the next talk. I would now request Dr. Preeti ma'am to please introduce our next speaker for today.
Yeah. So our next speaker is Dr. Sabyasachi Sengupta, and he'll be talking to us his use of AI in statistics. And he again is a Bombay man, and he's by profession and training, he's a veterinary surgeon. But if I have to again describe him in one word, he is the numbers man or the statistics man. And that's what he's also chosen as his topic. So let's learn from him. His lectures are always very interesting. So over to you, Dr. Sabyasachi.
Thank you, Dr. Preeti, and a very good evening, everyone. So, keeping in, just quickly share my screen. I'll share the whole screen. I hope you're able to see it, right?
Not yet. No.
Yeah, is it a YouTube?
Yes. Okay, so
Yeah.
I'm just going to show you this. You may or may not be able to hear. Hopefully, you will. Just understand that this is an avatar. This is not the real guy speaking. And this entire presentation will go through the first maybe 30 seconds. It's entirely AI generated. Okay, let's see if you can hear it as well.
This guy has no tech
Yes, we
background,
can hear
never
it.
learned to code, runs a business making over $100,000 a month building software for clients. The skill that made it possible, he just describes what he wants in plain English and a tool builds it for him. The tool is called Lovable. I run 3 companies and I consult founders. Whenever something is being done manually, we don't hire for it, we build a software solution. Last month, we launched 4 internal products.
This is not the real guy speaking. This is entirely AI made. This guy is not speaking himself.
Okay.
Can you beat it? That is where we are. No. And then let me quickly show you some slides that Sunena ma'am has seen on Monday. Okay, so these are some of the slides. This AI is called GenSpark. I'm putting this up because Pranesh didn't bring it up, but I think that I use it quite often. I also use Gamma. So these are some of the slides. AI for fast, smarter residency. Okay, so I'm just not going to go in through the whole details, but this is the whole presentation. And it took about 20 minutes to create this based on some of the prompts that I gave it. And you know what I did in those 20 minutes? I went for a swim with my 4-year-old son. I would give anything to do that. Really anything to do that. Right. So then, I'm pretty stoked with using these things, not because, of other things, but what it frees me up to do. And so these are the, things that we can do with it. So, so look at the prompt. If you see, it's going to be quite complex, quite long, right? So none of us can write a prompt like this. So I'm just going to scroll through the prompt, right? So this is the entire prompt, like very long prompt. If you see, this is like till here, and then, it is going, it'll say I'm using tool. So it basically uses Nano Banana Pro, and it says these are all the tasks, and it basically this is all automation. So these are each slide, and it has created all of this, create this slide and whatever. All of these slide outline is there, and you can actually go and change it here, and it will reflect back into this. And it is using Nano Banana Pro in the backend. So then how do you write these kind of prompts? So let me show you the prompt again. So this is like a, so section 6, sections 8, all of these. So what I have done is actually I have brainstormed with ChatGPT. Right. So if you see, this is my prompt with GPT. This is a pro version of both GenSpark as well as GPT. So this says, I want to make a presentation using these outlines in GenSpark AI. These means all this, lot of discussion. So you just don't go and tell it I want it. You discuss, you go through all of this, and what is the outline, how will it look like, and then you say, okay, now I want to put all of these into a slide. Can you help me with this? Let's keep the slides light on text, whitish background, break these into layers. So use perplexity site and whatever, layer 2, layer 3, Notion, layer 4 slides, and all of this. And then it says, okay, excellent, this is exactly how you should approach it. And then this is the prompt, clean, modern, AI for smarter residency design style, right, till and then structure. And then this is what it looks like on copy pasted. Right? So this is prompt, clean, modern professional AI for smarter residency design style, background, minimalist, use icons, structure. Exactly same thing. Clean, modern, professional AI for smarter residency, background, white, minimalistic, icons, structure, right? So, and then I have just gone. I've just, from here on, I've just said, okay, make AI slides, make, and I've just gone. Right? And when I come back, I say, wow, this is like amazing. Of course, I've changed a little bit here and there. So if you see these, these all work on credits. So if, let me say, 1 second, let me show you the credit way it works. Maybe I'll have to go to the home page. So this is GenSpark, right? And if you see, no, it's not moving. These credits are hidden behind. Okay, so these are credits. If you see here, so we'll say credits 14048. Credit basically are nothing but tokens, that Pranesh was talking about. So you get 10,000 credits for $20. That's like a month's use for GPT or Gemini and all of these. And so you buy only that $20. $20 is like, somewhere around, with tax it comes to around 2,000 something. And then you can have if your prompts are good. So this entire presentation of about 15-16 slides has consumed about 3.5 to 4,000 credits. So you can actually make 2 or 3 presentations like that, right? And then if you go and try the free version, you will have like 2 slides, and then it will say, you can't go ahead, right? And then if you try the free version of GPT, you are not going to get these kind of prompts either. So I use pro versions of pretty much everything, so including the statistical AI that you'll see. But then, also remember that these companies are actually fighting for survival, because, they are spending a lot of money to give us these, but then everybody seems to be only wanting to use the free versions. If nobody uses the paid version, we are all going to be out of all of this pretty soon. All of you keep hearing about the AI bubble and all that, right? So, try and exploit some of these limitations by going into the pro versions, and maybe try it for a month. But please make an attempt and sort of break that mental barrier, and you will really reach places where you could not have imagined at all, right? So because not because it's fast, but it frees you up to do something better and something more meaningful. It gives you that that design thinking the thinking time, so that all these mundane activities can actually be done by AI. Okay, so now let me come to the presentation that I wanted to share with you. And I thought, because I'm showing you an AI, let me use a traditional presentation. So we're talking about statistics. Let me go quickly to the, the concepts first. So if you are wanting to use an AI, you need to write the prompts, right? And if you don't know the basics in statistics, there is no way you can write a nice prompt. So a couple of questions I'll start with. So first thing, sort of a statement which will be seen in any kind of paper is, so I'll just read it out. So the central macular thickness reduced from 480 plus or minus 130 microns to 320 plus or minus 80 microns in the Affleber subgroup, and say consider this as diabetic macular edema. And from 489 plus or minus 140 to 340 plus or minus 90 microns in ranibizumab at 3 months follow-up. So this central macular thickness could be replaced with intraocular pressure, with vision, with with endothelial counts or whatever, and these numbers would accordingly change. But the outline would remain like this. So think about whether you have seen any line like this in any paper and actually made real sense out of this. Right? So the answer is yes, I have seen, but I'm not really sure how to interpret this. Right? But this is so fundamental in how we approach. That's why, because we depend on this p-value. So this says the reduction in macular thickness in the two groups was comparable without any statistical significance. P is 0.63. So what is this P? How did it come about? What does it say about these reductions and these comparisons? And if P is 0.05, we magically say, oh, one is better than the other. And if we say P is 0.07, we say, oh, both are the same. But is it the right way to approach? Is it the right way to think about this? Is something that we actually don't understand very well, and AI will help us understand that. So what I'm trying to say is that if you understand how to use this AI, it will of course help you do your own statistics, but it will really help you understand what is being published and what you should really trust. Is this paper trustworthy for me to make this change in my clinic? And so is this data or is this paper really pushing me towards using this new injection or drug or whatever? And how confident can I be that what these authors are saying is really true? It could be published in the New England Journal of Medicine, or for that matter in Ophthalmology or JAMA, and yet there could be problems in the paper, right? So AI will help you not only do your own work, but also understand how science is evolving and what you should adopt and what you shouldn't adopt. Right? So here what we are getting is this p-value based on some basic tests which are done in the background. And so it says that there is not much significance. And so what we need to understand is what is this test being done in the background? And is it the right test to use? And how to interpret this p-value, right? And we'll use AI to understand how to do these things. Another statement that we might hear in papers is someone compares the lipid profile of 50 patients with glaucoma and 50 age-matched controls, right? So reading it again, lipid profile of 50 patients with glaucoma, say over a 1 month period, and 50 age-matched controls, and shows that 60% in the glaucoma versus 15% in the controls have dyslipidemia. Now, P is statistically significant. That's almost 4 times higher, right? Can you conclude that dyslipidemia is a risk factor for glaucoma? Right? So in other words, really what we're asking is dyslipidemia association with an increased risk of glaucoma. So you need to make up your mind whether, so this is actual paper published in IGO. And so, the conclusion was that, as your lipid profile worsens and you get dyslipidemia, your risk of glaucoma increases. Unfortunately, that's not the right way to go about, and if you put this into AI, it will clearly tell you, oh, hang on, wait, let's break this down. And in its own indomitable way, it will tell you that this is not the study designed to actually answer this question, right? So let's not look at AI just as an amplifier of your own research, but really an amplification of how much you are now able to understand any published paper. So quickly we'll run through this, the basics for about 6 or 7 minutes, and then I'll actually show you the use of that AI. Right? So this is an ebook which will have, I'll show you this QR code again, but this is an ebook which will have almost everything that I'm talking about in the next few slides, right? So overall data really means any observation that comes from an experiment or research, and variable means any set of observations. Essentially think about columns in the Excel sheet, every column in the Excel sheet, like age, gender, vision, OCD thickness, number of injections, and what have you. These are all variables. So essentially every row is a patient, or at least one visit, right? And so it's patient specific, and every column is these, are these variables that we are recording. So you can't have age as a row, right? And all patients in columns, so that you can have like 700 columns if there are 700 patients. That's not how we do it, right? We have, we have say 15, 16, 20, 30, sometimes 50 rows, columns, which are all these variables. And then each row represents a separate patient or a separate eye. Right? So then we could have 700, 7,000, 10,000 rows. Right? So that is what essentially a data sheet looks like. Now we look at variables in terms of whether they're continuous or a categorical variable. Right? So to differentiate this, we need to understand continuous means it's a quantity, right? It's like kitna kilo rice leke aaya bhai aap. So it's like you can measure it and it will have a unit to it. So rice will be in kilograms. Right? So it'll always have a unit to it and you can actually measure it, and it could vary from very small to very large values over that entire scale. So it's a continuum. So example is age is in years, BCVA is in logmar units, and it can be, or Snellens, it could vary from 0 or sometimes even better than that in terms of say 6 by 6 to like hand movements, which is like 2 logmar. Right? Intraocular pressure, it could vary from like 0 to somewhere around 70, 75 also, rarely. But so it's a continuum, 35, 36, 37, 40, 45, and it's in millimeters of mercury. Same thing with macular thickness or with retinal fiber layer thickness. These are all continuous variables. Other are categorical variables. Categories, we are not saying how many kilos you brought. We are qualitative. We are putting people in baskets. So they are in categories. Say for example, male and female, right? There are two only, there can't be a unit to this, right? It could be either male or female. It could be success or failure. It could be type 1 or type 2 closure of macular holes. It could be open or closed globe injury. So these are based on the quality of that variable, and we'll put them in either one basket or the other, right? So either continuous or categorical. So categories can have only two categories where we will call them binominal, right? Bi means two, or it could be more than two. When it's more than two, it could be in an order. Typical example is mild, moderate, severe NPDR. That's an order. They're more than two. It could be mild, moderate, severe NPDR, high risk PDR, and early PDR, and all of that. So 6 or 7 categories are there, but they are all in an order, but more than two. So we call that an ordinal variable. Now, if there are more categories, but not in order, we call them multinomial. Right? So more than two categories, but not in order. Say, for example, injections. Quick exercise, think about it, is height of subretinal fluid in CSR. Now that's in microns. That's a continuous variable. Presence or absence of hard exudates. That's in DME. That's again a categorical variable. You could say number of hard exudates. And if you have the time and patience to, to actually go count, or you tell an AI, Buzzy, you count all of these and tell me, that will be certainly a continuous variable. But here it's a categorical because you just say presence or absence. Response to IVTA or any injection, good, fair, poor. There's an ordinal variable, right? You could say good or bad, then it becomes binominal. Number of days of follow-up of a patient. Right? Now that is in days. And it could be like 1, 2, 3 days, 365 days, 720 days. That's a continuous variable, right? So these are some examples. Making Excel sheet is very, very crucial. And like I said, there are 2, 3 important things you should remember, though that list is about 10 or 12 things. Everything which is alphabetical should be only in the top row. Age, gender, whatever. So that's the name of the variable. We are labeling that variable. So the top row can have alphabets. Alphabet should ideally be not there in anything from row 2 and above and below. That's why I see many times people are merging this and say pre-op and 6 or 7 merges, and then post-op some 10 merging. And then, so all that will go for a toss as soon as we import this into a statistical software package. Right? So it's ideally best to not have alphabets. Believe me, statistician spends almost 80% of the time cleaning that data and only 20% of the time doing some analysis. Right? So we send that data sheet to the statistician and say, we raise our eyebrows and say, kya hua bhai? And then he'll raise his eyebrows back at us and say, kya hua bhai? And it's like, oh, I don't know what you're talking about, because your data is so poor that I can't even make head or tail of that. I have received data sets in a Word document, believe that. Not, not in Excel, but in Word. That too from a group in Italy. And it's like, oh my God, I was like, I can't do anything about this, it's like that. So make an Excel sheet properly. So again, other 2, 3 things is, each eye should be a separate row. OD and OS should be separate rows. Or each patient should be a separate row, for example, right? So a few things that you should be, careful about when making Excel sheets, and you can, watch this YouTube lecture on that. Once we have these variables, what we do is we describe them separately, right? So, think about each variable, humanizing that variable. That variable comes in front on a stage and says, hello, my name is age, and this is what you should know about me. Then the next one comes in and says, hello, my name is gender, and I'm, there are so many men, so many women. Third variable comes and says, hello, my name is intraocular pressure, and this is what you should know about me. So what you should know about me, or that variable, is called a descriptive statistics. Now we are talking only about one player at a time. Say in a cricket match, the IPL has started, some batsman has come to play. People will show his name, his record. Even if he is Rohit Sharma, they will show his record and what is it about. Then they will start playing, right? So we need to describe each each column separately. So description is continuous variables are described as mean with standard deviation or median with interquartile range. And of course, range, that is smallest and largest. Then we use something called outliers, and they are shown best with box and whisker plots. Outliers means really extreme values, which will pull the mean towards either side. And so why I'm showing this is because I will show you this on how to make it on the AI. So box and whisker plots are the best way to show continuous variables. Categorical variables is simple. It's just n and percentage. So proportions. And we, it can be shown with bar diagrams, pie charts, and others. Right? So this is essentially what we are doing in terms of describing the variable. So this is how a box and whisker plot looks like, right? So the center one is basically the box. The central line is the median value. The lower is 25th percentile, the upper is 75th percentile. Then these are whiskers, which is 10th and 90th percentile. And then you have these dots. This is like extreme values. So the pressure, intraocular pressure is 0 in a particular patient. That is preoperatively. Definitely this is a, this is an error in data entry, right? Instead of 20, somebody has just maybe entered 2 or maybe entered 0. Right, so this is something that is a data entry error, and this is perhaps a reality where there is some patient who has a pressure of in high 50s because this is a glaucoma study, right? So then outliers help you understand what is happening. Why is this patient behaving so badly? Is it just a data entry error or is it real? Now, if it's real, do I want to keep this patient or do I not want to keep this patient? If I want to keep this patient, do I want to give him enough weightage and allow him to pull the whole study towards him or not? There are things which you can do, but you need to know if there are outliers in your data set. There's some complex box and whisker plots, but again, nonetheless, these are box and whisker plots. Now we look at analytic statistics. Now the people have started playing each other, or the team has playing, and so one variable will interact with the other variable. If one increases, the other will increase or decrease, and things like that, right? So what do you mean by analytic statistics, right? So there are three basic forms. One is difference between variables, second is correlations, and third are associations, right? So differences, when we use differences, we use these tests for significance. If it's a continuous variable like we saw in the first, like central macular thickness, next question we ask is if it's normally distributed or not. We don't have a lot of time to understand what is normal distribution, but if it's normally distributed, we use the student t-test. If it's not, we use the Wilcoxon rank sum test. The AI will know which test to use, but you still need to confirm, did you use this test or not? After a while, you will understand and the AI will learn with you, but you need to understand whether the test used by that AI is right or not. If there are more than two groups, they are normally distributed, we use something called ANOVA. Right? So, I was doing an analysis for some groups, and the resident of that group called me and said, "Sir, are you using the ANOVA test?" I said, but you have only two groups. No, my boss told to use ANOVA. I said, that's like impossible, no? So there are different things. There's something called repeated measures ANOVA and all, which is totally outside the scope of what we are discussing. But understand that ANOVA can't be used for group, when there are two groups. Say, just an example. So if AI will never use ANOVA, utna bada mistake nahi karega. Now, if you're comparing across categorical variables, we use something called the chi-square test. Okay, so this is part of the ebook that I'll be showing again, that QR code. So if it's continuous variable, two groups, and it's normally distributed, we use student t-test. If it's two groups and not normally distributed, we use a rank sum test. If it's more than two and it's normally distributed, we use ANOVA. And if it's not normal, we use Kursal-Wallace. If it's categorical, no matter number of groups, we use chi-square. Cat is chi, right? So this is basic of that. And so there are many different blogs on my website that you can actually take a look at. So here, when you look at this basic problem that we started with, now macular thickness, now you have a different perspective. Macular thickness reduced from this to this. You got a p-value of this. So this is a continuous variable. This is normally distributed is what I'm saying. So you have to believe me for now. So a quick tip is that if the standard deviation is more than half the mean, it's more than half the mean. So here it will be like 240. If it was plus or minus say 290, then that standard deviation is very large. That means there are some outliers. Then that is not normally distributed. So here it is normally distributed. So here we are looking at a continuous. I'll go back a couple of slides. It's a continuous variable. It is normally distributed. So that we use the student t-test and the output we get is the p-value. Right? So this is the p-value and this is not significant. Right? So this is essentially what we do. Some more examples. So this is an example of a glaucoma study from PGI where they compared Ahmed glaucoma versus RD. Right? So here if you see age, the Ahmed valve patients are 52 plus or minus 16 years and RD is 47. So it's almost 5.5 year difference. Significant. So AGV patients are older, RD is younger. Within the context of this. Next, if you see mean visual acuity, right? So AGV 0.62 and RD is 0.68. So RD is worse vision. Older patients who are having worse vision. Okay, and then again, if you see mean combined drops, RD patients are on half drop more mean. Then they are mean topical anti-glaucoma medications. If you see, this is the mean, combined anti-glaucoma and mean topical is also higher, and oral medications is also higher, right? So are these groups comparable enough? RD are younger, we are more prone to failure, right? They are younger, they have worse vision, they have significantly higher IOP with more number of medications. I mean, IOP is not high, but they have worse glaucoma and they are younger. All this says that RD will perhaps fail more, right? So then later on, can you say, oh, AGV is better than RD? No, we cannot, because RD you set it up for failure even before, no? But actually the results showed that RD is almost 2 times better than AGV, despite the odds. And so that shows us that it's not 2 times, actually it's maybe 4 or 5 times better. If you adjust for all of these basic differences even at baseline. Right, so what tests would be used here? If you see, this is a continuous variable which is normally distributed. This is again p-value from the student t-test. Again, same thing, student t-test. If you see age, it is normally distributed 2 groups, right? And the student t-test is used and we get this p-value. So this is essentially what the statistical tests will be doing. Now let me go to the AI. The AI that we use is called Julius AI. Okay, so this is Julius. This is again a pro version. If you see, this is 1.1 max. There are many different versions. We can just leave it at that. Okay. Now what we should do is this code language. It's better to keep it as R. Okay. Now let me show you what we do with the analysis. Okay. Now let me pull some data set for you. Okay. So this is. Okay, so this is the protocol T dataset from the DRCR network studies. This is all available online, and you can write to me and I can send it to you. So I just put it up and it's loading. In that time, let me show you what that dataset shows. Okay, so this is that dataset. If you see, this is patient. I'll just blow it up a little bit. This is patient ID. This is randomized eye, right or left eye. Only one eye per patient. Drug, bevacizumab, aflibercept or bevacizumab or ranibizumab. Right. So there are 3 drugs. This is central retinal thickness at baseline. This is central retinal thickness at 4 weeks. This is central retinal thickness at 8 weeks, at 12 weeks, at 16 weeks, at 20 weeks. That's how it goes. And then this is ETDRS vision baseline, 4 weeks, 8 weeks, 12 weeks. I mean, there are a lot more, but I have just sort of curated this for you. And if you see, this goes and we'll see how many patients are there. I'm just going to scroll down on the left. You can just see the number of patients. Right? So it's very difficult for us to make such great data sets for learning purposes. So you can use this protocol T. So this actually had about, I also forgot how many, but there's a lot of patients in this study. There's about 847 patients, right? And then what you can do, right, with Excel is actually you can filter these out. So if you see drug and if I just select aflibercept, you will see
How
that.
long, Dr. Sengupta, sorry to interrupt you. How long is this going to be?
I can stop right away actually.
No, I'm not saying the topic
So this is
is
basically
AI
the
in biostatistics. So that's what
what is the data set about. You can tell me when to stop, I can stop. Data set about, right? So let me
No,
just
you
show
go
you.
through the salient points. That's what I'm saying.
Yeah,
That
okay. So this is protocol T, and so I have not told it anything. Now it is going to actually say what it is about, and then we'll perhaps do one test and then we'll call it a day, right? So it is actually thinking, and it is, if you see, it is going to write some prompt. Till that time, we can ask it, show me a box plot of, unless you tell that box plot, it is not going to understand. Show me a box plot for macular thickness at different time points stratified by drug. So this is the prompt. If you see this, I have not told it anything. What is this data set about? It looks like clinical trial data set in ophthalmology. It is understanding patients with one randomized study, one eye study, eye over time, and comparing anti-VEGF agents. There are 3 agents. The structure strongly suggests it is from protocol T, well-known diabetic macular edema treatment study. What are the variables? It is telling us what are these variables. Then time structure. So it understands pretty much everything. Size of the data set, treatment groups, 224 and aflibercept. I just showed you that, right? So these are 3. And then in plain English, this is what it is, right? Now what you can do, it is also telling us what it is. So I'm just going to ask it one prompt. So show me a box plot for macular thickness at different time points stratified by drug, and we'll see what it does. So it's going to write a prompt. And if you see, this is all the prompt that it has written in the previous one. Right? So this is all prompt. It is using something called R statistical software at the back end, right? So if you don't understand what prompt to write and what test you want to do or what is the result that you're looking for, this is no good, right? So you have to understand that we have to understand this prompt engineering or prompt writing. Even in Pranesh's presentation, he was actually in the end going to how to generate the best prompt, but then it was getting a little, little confusing or a little difficult, right? So these prompts are difficult. So here again, writing the prompt is what will separate you from anybody else. So you need to understand how to write the best prompts, and for that, trust me, you have to be better educated than being uneducated, because it will show on your presentation that, oh, this is just this is AI, and people who understand will understand that this is not the real thing, and this is hurried up, like BK Nayak sir was saying, so it will actually show. So you in fact have to put in more work to get the better result out of it, right? So it is taking a little bit of time and it will generate, so this is basically what it is showing. I think this is the graph that it is showing. Plot without titles, image 1. So it'll actually display a few things, but this is not a box plot. One second. Okay, so this is essentially overall, but unfortunately it's not looking, I think it has heard that we are trying to, make it go quicker. Show me a better plot. Or what's the best way to show this graphically? If you don't know what plot you should use, then you can simply ask it, what is the best way to show this graphically? I want to show the values across time. And so it is actually thinking about it, and then it will actually show us that plot. You can also say, so what is the mean thickness in aflibercept versus ranibizumab versus, so by drug at baseline, show me the values, mean and standard deviation, and is it significantly different? So we'll perhaps end with that. So what is the mean macular thickness at baseline across the 3 drug groups? Okay, so this is a plot which it has shown us. Let me blow it up for you if you want. So these are the macular thicknesses over time. This is bevacizumab, ranibizumab, and aflibercept. Right? So this is on top is aflibercept. So this is quickly showing us that there has been a reduction, and this is the 95% confidence interval that is going. So manually it is almost impossible to create these plots so quickly, because you will have to write a lot of code. So this is one, and
I think we can
yeah,
take the discussion now. Is that okay?
sure.
Yeah. If you can.
Ma'am, can I add something now?
Yes,
Top
absolutely.
share, yeah.
Yeah, so I had used Julius AI. Actually, we conducted a quiz, and I didn't know how to standardize between 3 groups and to find out the top winner. Julius AI was amazing, actually, and very nice. I was just looking at this, and it was reminiscing, because it told me to take the Z score, and it told me about the reasoning about it. I was not a very statistic guy, but it really helped. Julia says does a really good job. It gave me a output in Excel, and I was able to take it. It would have taken me at least 3 days to get it done, or if I had to give it to a statistician, I got it done in 2 minutes.
Wow. So nice presentation, Dr. Sengupta. And yes, to understand what it's telling you, or to give an order also, you have to know what order to give. So for that, you really need to know your statistics well. So what you're saying is a good point taken, that you need to know more in order to give the order. So I will start with Dr. Nayak. Sir, you're here? Yeah, sir. So you tell me your take, because you are also a statistics man. Dr. Rajesh Joshi is also a person who runs the JCOR. So he also needs to use statistics. So what is your take, sir? Would you be using it? Or if you start using it, how would you use it?
How would you use it means basically all this, whatever Dr. Sengupta just now explained, that is true. But then first of all, you have to know yourself, the statistics. Then you ask the final calculation and other things and plus you should also know, as you showed the chart, that which test to perform, because then you have to give the data and you have to ask which the particular test which is suitable for that type of data and that type of group, then that will give you answer immediately. So those things, but then at least you have to understand the topic. So Chat GPT or all these AI cannot means presume that not presume means cannot make you expert in the basics of statistics.
Absolutely right. Yeah. So about this, yes, we are very clear, because if I ask the Chat GPT a cornea topic, I know when it makes a mistake. Why? Because I know the anatomy, physiology, and functioning of the cornea. So I'm able to point out what's wrong. If I ask something about glaucoma, I'm able to point out what's wrong. But so the similar way, if you don't know biostatistics well, and if you're just going to use AI, it's not going to work. So Dr. Joshi, how do you use? I'm sure you must be using AI for your biostatistics because you have so many papers to accept, to reject, or give, give improvements to. So how are you using AI for in biostatistics?
In fact, if you have a good Excel sheet, and if your data is well fed into Excel sheet, invariably Excel sheet will give you the statistics. Most of the statistics, what you want, you can generate it from Excel sheet only. I
Without
think
using any kind of AI?
if you know which test to be applied, basic statistics, I would say, basic statistics part. And if you know the test, Dr. Sabyasachi has very well elaborated on which test for what test to be used for what. If you know these things, then your statistics you can do yourself only. You don't have to take any help. But for the final thing, you can definitely use AI. I haven't used AI for any of the statistical part.
Oh.
But a few things I want to ask Dr. Sabyasachi regarding use of or acknowledgement of AI for use of the statistics in research articles, or use of AI for reviewing the articles which have not been written by AI itself, and use of AI for preparation of the manuscripts. How far you can do this, Dr.
No,
Sabyasachi?
I think it's a little bit out of the scope of what we're discussing, and I don't think we have so
definitely.
much time to discuss. So let's have
Right.
another whole session.
Sure. Yeah.
No,
that is
so
all from my
ethically,
side.
okay. Do you have to declare when you are submitting a manuscript? Do you have to declare how you have used AI, Dr. Sabyasachi?
So actually, every journal has its own way of approaching. So maybe Dr. Rajesh can say what JCUR is doing. Most journals will have it on their home pages of what they expect from.
If it's a journal policy, then you have to declare. Some journals have very
hello.
clear policies.
Right.
Okay. Hello, sir. How are you?
I'm good.
Welcome, sir. Thank you for joining. And yeah, so how have you been using AI? You were the editor of IGO, but that time AI was not so much into the forefront as it is now. So if you were the editor today of IGO, how would you use AI to help you?
No, we don't use AI, we use AI detectors. I mean, if somebody has totally written an article on AI, then we need to know that. And it is very obvious. For a trained person, it is very obvious that a particular article or a paragraph has been generated by AI. The pattern is very easily recognizable. Just like you do a diagnosis, it's easily diagnosable. But if you want to prove it, then you can check. But at the same time, for statistics, I think AI is a logical extension of all the softwares that they were using earlier for statistical analysis. It makes life easier. Statistics is not creative, it is science. And AI is just an engine to accelerate the process of generating correct statistical analysis or appropriate statistical analysis. And for us, it helps in understanding the analysis more than doing it. I will never do statistical analysis myself, advanced statistical analysis, because it is a professional's job. And somebody trained such as Sunny can do it by himself, but we may apply wrong statistical tools, or we may interpret it slightly differently than what it should be. If we indulge in that, we are good clinicians and we should stick to our domain. And for statistics, I would definitely depend on an expert. But having said that, understanding statistics, as Sunny put it, has been made really easy by AI tools. If you really want to understand what is written in a very jargonish statistical language in a particular article, then of course AI can make it simple for you. That is where I would limit use of AI for statistical analysis, but rest of it has been, I think, well covered, extremely well covered.
Very, very nice. So those are great points. We have Dr. John. Where is he? Okay, Dr. John, your take. How do you use it Because you do publish a lot. How do you use it? Is he there?
I think he's not there.
He's not there. Dr. Gunjan? Yeah. How do you use it when you are presenting? Not, I mean, when you have an article or when you have a paper to give. Are you using AI?
Hello.
Hello, yeah. Hi.
Okay. So, ma'am, I have not used it for paper publications yet, but I know because some of my friends had used it, but they got this message from the journal that this looks like AI-generated content, so you should go and revise it. So, till now, I'm very careful when I'm writing papers because it becomes very difficult for the reviewers. And once your paper is rejected for something, then it takes a longer time. So I'm little, not using it for publications, but yes, in slides, I do use AI at a lot of levels,
Great. So if
especially when I'm trying, yeah,
no, please go ahead. Please go ahead.
sorry,
I'm sorry.
yes, ma'am, please continue. I was just saying that some of the slides I have some slides from older days, so I can, make that slide little better with the use of AI with the right knowledge and content that I have actually used a lot because it saves a lot of time when you are making some graphics and content in this. Because in the earlier times when I used to make my slides, I used to make it myself, the cover page, and used to take a long time to make graphics and all. And everything is now very easy. Just you need to put the right you know prompts and all. So prompts is somebody's zone where you can use the prompt the right way. If you know the content, then you give the right prompts. Because say if I'm making some slide and I'm giving some content, and say somebody else who's no non-medical, if I give it to somebody who's a non-medical, he'll not be able to make it the way I want it to.
True.
So that is how it works out.
Yeah. So I would say is it Dr. Hunavar hit the bullseye when he said that for all of us who are not very good at statistics, maybe we can use AI to make sense of a paper we are trying to read. But if we are going to use it, we should not use it when we are publishing our own papers. It is better a job left to the biostatistician. So is that correct, Dr. Santosh?
Yeah,
That
that's exactly what I meant, but you can use AI to clean up and you can use AI to generate a good Excel sheet, because at the stage of designing a study, the statistician should be involved. And if you don't have one, you can use that for that particular aspect. Otherwise, what I said, I still stand by because I'm not an expert in statistics and I would leave it to an expert.
I do agree. So, so let's come to the
Just
end.
wanted to add about statistics. Add one thing about the statistic part.
Hello.
Hello.
Go
Yeah,
on,
yeah.
Gunjan,
Go ahead,
go
go
on.
ahead.
Yeah. No, I thought I lost my connection for a while. So just saying that the way sir was talking about that there are sometimes very complex statistics that needs to be taken care of. So one of the recent thing that I was trying to compare different modalities in the surgery for one disease like keratoconus, and I was not able to get the right kind of test. So I was just using some ANOVA T or something. I was just confused. So I just went to ChatGPT and I tried to ask about what test should I use, and it gave me a prompt which I have never heard of. So I just verified it, and that test was actually right for what I was reading on. So sometimes it may help you, but you need to verify what is there.
True. There is one question which has been asked. If anybody is willing to take, will AI be helpful in any way in telemedicine in ophthalmology? So that's what one of the questions is. So, sir, you want to take that? So, Dr. Santosh?
Yeah, so it can help. AI is all based on pattern analysis, and it can rapidly screen out patients if a particular center, where screening is being performed, sends thousands of images, out of which you want to triage a certain set of images to the clinician. Then AI can filter out. If you're given a good algorithm, it can filter out images which are not, abnormal. right? So the normal images, but you have to actually train it in such a way to recognize these patterns. And if it's a trained AI, then it can reduce the burden on the clinician. Of course, there will be errors, and over a period of time, it'll learn, because AI is something that continues to learn all the time. If you train it well enough,
Already we
then
have.
definitely help. Yeah, we already have it, so it can
We
help.
already have in many of these fundus images, so they give the pattern both for glaucoma as well as for diabetic retinopathy.
Right. But
So,
as a telemedicine thing, if you have peripheral centers, 10 peripheral centers,
Yeah,
you're
so that can be used as a telemedicine thing.
right.
Yes,
If
and
they are
those
sending
images
only
are then sent
images,
to the
then you
main
can,
center.
you categorize
Yes,
images and send only
yes,
that particular set of images to the clinician.
right.
correct.
It has been used in glaucoma, definitely.
Yeah.
Glaucoma suspects, normals, and glaucoma. So the normals are just filtered out. So in a small sense, yes, it can be used. So I hope, Dr. Manik, this answers your question. And I think we now, if there are no more questions, we can end this wonderful webinar. And Dr. Rakhi, you want to do the honors?
No, we'll leave it to Dr. Anaka, ma'am.
Okay,
The
Dr.
water
Anaka, if
plan.
you can just
Thank
conclude.
you so much, everyone. I think that was a wonderful webinar, and this was a very different topic and handled so well. Thank you so much, Dr. Santosh, Dr. Nayak, Dr. Rajesh, and all the others, Dr. John, Dr. Gunjan, Dr. Rakhi, and Dr. Preeti, for moderating the session. And both the speakers were really excellent. I hope all the viewers also benefit from this. And next time we'll come out with how AI can help in other things too. So we just wanted to focus on these two topics in this webinar. Thank you all so much. Thank you.
Thank you, everybody.
Thank you,
Good day.
Numeratech. Yeah, thank you, Numeratech.
Good night.
Thank you.
Good
Thank
night,
you.
everybody. Bye.
Thank you.
Good
Thank
night.
you.